India's first case of monkeypox was reported from Kerala on July 14th. The country's first confirmed case of COVID-19 was also detected from Kerala in January 2020. Kerala has seen 3 outbreaks of the Nipah virus in 2018, 2019 and 2021. Kerala also happens to be the first Indian state to report an outbreak of Lyme disease back in 2013. Then there's tomato flu, a viral disease that was first detected in Kerala and has since spread to other places. So why does Kerala appear to be a hotbed of infectious diseases? Let me explain. There are broadly 3 reasons why Kerala appears to be grappling with infectious diseases. 1. Kerala has a huge diaspora. There are around 40 lakh Keralites living outside of India according to the state government. This increases the chances of diseases being imported into the country. If you look at the first confirmed case of monkeypox or COVID-19, these were travelers who had returned from foreign countries to India. In the case of monkeypox, the 35-year-old male patient had returned from the UAE to Thiruvananthapuram. In the case of COVID-19, the female patient was studying in China's Wuhan University. She ended up testing positive for the novel coronavirus in Thrissur a few days after her return. Both monkeypox and COVID-19 were imported cases. Now, you may point out that states like Uttar Pradesh or Bihar have more migrant workers abroad than Kerala. So why aren't these states reporting cases like monkeypox, for example? This brings me to point number 2. Better awareness and surveillance. Let's go back to the first case of monkeypox. It was the patient who came forward and told health officials in Kerala that he had been in contact with someone who had contracted monkeypox. In the case of the first COVID-19 patient as well, she had been instructed by health officials to isolate and visit a hospital if she developed symptoms. This was because of her travel history. Public health expert Dr. T.S. Anish, who is an assistant professor of community medicine at the Government Medical College in Manjeri, told me that the reason Kerala reported both the first case of monkeypox and COVID-19 is because people are aware of the symptoms of these diseases and are reporting to hospitals, and because Kerala's health system is catching these infections. So whether it's tomato flu or monkeypox, detection often points to a well-functioning public health infrastructure and disease surveillance system. Kerala's strong surveillance mechanism has been built upon the Integrated Disease Surveillance Project, which has been broken down into several district units. In addition to this, the state also has a Prevention of Epidemics and Infectious Diseases cell in all government medical colleges. These cells carry out research and training of health personnel to control outbreaks. Then there's the State Disease Control and Monitoring Cell, which monitors and investigates outbreaks. Kerala has a daily monitoring system working throughout the year to pick up any unusual health event. This surveillance system has been put in place because of monsoon-related diseases and because of past outbreaks like dengue. But there's one more reason, and that's point number 3. Human encroachment into wildlife habitats has made Kerala especially vulnerable to infectious diseases. In fact, one study published in The Lancet in May 2021 labeled Kerala a global hotspot for infectious diseases, along with Northeast India, China, Bhutan, Java, East Nepal and Northern Bangladesh. So why is it a hotspot? The reason is that forests are being depleted and these lands are being used by humans for agriculture and livestock farming. This has resulted in more encounters with wildlife and as a consequence, viruses being transferred from animals to humans. In Kerala, the first case of Nipah was reported from Perambara town, which is in the foothills of the Western Ghats. The Western Ghats are a biodiversity hotspot, but it is facing serious threats because of deforestation and urbanization. Now, studies have also found that when fruit bats, a natural host of the Nipah virus, get stressed because their habitat has been destroyed, it leads to their viral load going up and it spills out into their urine and saliva. This in turn leads to the virus passing on from animals to humans. Now, although Kerala is better at detecting infections compared to other states, its surveillance system is far from perfect. Experts have for years been emphasizing the importance of the One Health approach when it comes to controlling zoonotic diseases. The One Health approach basically calls for experts from public health, animal health, and environment to work together to detect, respond to, and prevent zoonotic diseases like Nipah or COVID-19. In fact, in 2013, India reported its first outbreak of Lyme disease in Wayanad district in Kerala. Lyme disease is caused by the bite of a tick found on deer, but the outbreak was quickly contained because of the One Health approach, with teams from different departments working together to identify the disease and then control it. Kerala finally launched its One Health program against infectious diseases in May this year. But there is one more factor that can strengthen Kerala's surveillance system, and that is testing facilities for infectious diseases. Kerala is sorely lacking a biosafety level 3 lab to test for highly contagious diseases like Nipah. In fact, my colleague Sarita Balan had reported in September last year that although Kerala set up the Institute of Advanced Virology in 2019, it is unable to test for Nipah. Despite 3 outbreaks of Nipah in the state, Kerala still has to send samples to the National Institute of Virology in Pune. It is crucial that Kerala gets its own biosafety level 3 lab, not just for the timely diagnosis of infectious diseases, but also to prevent an outbreak from spiraling out of control. I just want to quickly remind you that the News Minute has been bringing you Let Me Explain for several months now. If you value the work that we've been doing, do support us by becoming a member of the News Minute. And also don't forget to subscribe to our YouTube channel. And as always, if you like this video, do hit the like button and share this video with your friends.